I'm Judy Baumgartner, President of Millard Fillmore Suburban Hospital. It is my pleasure and privilege to lead the hospital during its 50th milestone anniversary. In looking back on the hospital's history since 1974, we have gained tremendous admiration and respect for those before us who envisioned the community asset the hospital would become and the continued growth and success that has followed. Building a hospital in the suburbs was a vision of local physicians and residents in Clarence and Amherst who recognized the need for a hospital and medical care close by with the anticipated growth of the area. Their dream would require rallying public support and endless perseverance for many years before Millard Fillmore Suburban was built. As we look back at their work and how the hospital has evolved since then, we are thankful and proud to continue to have dedicated physicians leading the way. Some who began their careers here as residents and have continued to serve our patients and community for the duration of their medical careers.
In August of 1974, I was a resident. I was a second-year resident in general surgery. I was going into orthopedics the following year. And there was pretty much a lot of excitement about the opening of a new hospital. You didn't open new hospitals. This was a unique thing. So the place was teeming with young people, with all that energy. And it truly was a lot of excitement. It was fun to be there amidst all this education and excitement. It was an interesting area. I mean, there wasn't this big highway here. Of course, we didn't have a full load of patients in the hospital, but almost immediately it was a very busy GYN hospital. And then, as it turned out, they expanded here and expanded. I think the most exciting thing was when we started doing total joints here. It was a concept that, could we do it? We needed extra rooms, and somehow we got extra rooms, and I think that part of it was to prove to the staff that they could do it. I still see people in the hallway that I've known now for almost 50 years, and it was always that kind of an atmosphere. It was a fun place to work. It's been a great run. I wouldn't have missed it for the world.
In 1974, the hospital opened, employing a few hundred people to care for the sick and injured. Today, a team of over 1,800 care for the tens of thousands of patients seeking care at Millard Suburban each year. Over 800 of our employees are nursing professionals who serve as the backbone of our institution, providing evidence-based, high-quality, compassionate care. Just like our physicians, we have thousands of incredible nurses who have made it their mission to provide the best possible care for our community here, and in return have made a large impact to the field of nursing and the overall quality of care delivered to our patients.
In August of '74, I was just about ready to graduate as a surgical technologist at Millard Gates, and I was hired in September of 1974. So my 50th year of working in the system is the 50th year anniversary of Suburban. A lot of people were saying, well, gee, that hospital's way out in Amherst where all the wealthy people live. They don't get sick like regular people do. It's just going to be a little hospital out there where people are going to enjoy working, but it's not going to be heavy duty serious. That was kind of what was going on. And then it just kept expanding. I learned about a role that they were promoting and developing called Registered Nurse First Assistant at Surgery, which would allow you to work as an assistant to the operating surgeon. So I decided that would be something I would like to do. I was actually the first nurse in New York State to do this. So I had to have meetings with the State Board of Nursing and the State Board of Medicine and the Department of Health in Albany, and then it just kept expanding. The thing that we did here that I take the most pride in being a part of is the robotics program. I think the way we implemented the robotics was done beautifully. The circulating nurse and surge tech and I worked on how to set up the room, how to physically design the room so the robot could be moved in it. And we worked on, how to position the patient and all sorts of different things together before we ever did a case.
In the last 50 years, we've had tremendous advances in medicine and technology. At Millard Suburban, Those changes have continued to ignite the vision of our teams and, in return, the growth of our hospital. Once a small 150-bed hospital taking care of emergencies, surgeries, moms, and newborns, has become a 265-bed facility sprawling over 400,000 square feet. Suburban is now home to specialty care in cardiology, urology, GI, orthopedics, oncology, interventional radiology, vascular procedures, and a 10-bed neonatal intensive care unit. There are 13 main operating rooms with 5 robotic surgery suites, a host of specialty procedural suites, a mother-baby unit, and patient care recognized with national accreditations like the American College of Surgeons Commission on Cancer, American College of Radiologists in Mammography and Nuclear Medicine, and the prestigious Center of Excellence in Robotic Surgery. All of that could not be possible without the unwavering support of our community, who trusts their healthcare needs to our team of medical professionals and continues to provide financial support for our programs and services.
On October 22, 1962, 84 strong women on the board of the Amherst Clarence Hospital Fund Association pledged $100,000 to the building fund. That was the birth of the Women's Board. Their mission was to promote interest in the building, raise funds for projects, provide volunteer aid, and promote community goodwill for the hospital. There have been so many projects I've been proud of, but the most eventful one I will never forget was the year I was president of the Women's Board and presented a check in the amount of $500,000, our donation at the dedication of the Neonatal Intensive Care Unit. As of December 2023, the Women's Board has donated over $6 million to the Millard Fillmore Suburban Hospital.
To everyone in the past 5 decades who has walked through the doors of Millard Fillmore Suburban Hospital as a patient, family member, employee, volunteer, or physician, you've all had a hand in shaping what we are today. We thank you for your part in building a strong community hospital that has weathered enormous challenges in healthcare, survived a global pandemic, and still continues to thrive in the suburbs today. Like our founders, caring for our community is our driving force, and we look forward to providing high-quality, innovative, and compassionate care for many years to come.